In this video, I'm going to go over the external structures of the anterior heart. So you have the superior wide, broad area where we have the great vessels coming into or leaving the heart. This is the base of the heart. And then the inferior pointed region is the apex of the heart. The great vessels that we see here, we have the superior vena cava. This model, you can't see the inferior vena cava, which would look on the posterior side anyway. But this is the superior vena cava. Now you do have these two other vessels. These are not great vessels, but they would merge into the superior vena cava. This is the right brachiocephalic vein, and this is the left brachiocephalic vein. Here we have, and those would, the superior vena cava would empty into the right atrium. Leaving the right ventricle, we have the pulmonary trunk. The pulmonary trunk would split into the left pulmonary arteries, and then over here we can see the right pulmonary arteries, right in the back there. And then we have the aorta. Well, actually, I'm going to start with the pulmonary veins that are bringing oxygenated blood. This is more on the posterior side, but you do have the left pulmonary artery, so there's two openings. There's four total, two left pulmonary veins, and then here we have the two openings for the right pulmonary veins. You can also point out again that that's the right pulmonary arteries. And then the aorta, so the pulmonary veins would empty into the left atrium. Then leaving the left ventricle is the aorta. This is the ascending aorta. And then the aortic arch, and then coming behind, which is cut here, but you would have the descending aorta. Now the three branches off of the aortic arch, this first branch off the aortic arch is the brachiocephalic trunk. Then we have the left common carotid and the left subclavian artery. So left common carotid artery, left subclavian artery. I will discuss some of the other structures of the coronary circulation in a separate video, but let me go ahead and do the auricles here. So we do have these flaps that would overlay where the atria are, which we'll look at an internal view of the heart. This is the left auricle, or the auricle that covers the left atrium. This is the auricle that covers the right atrium. This would represent the left ventricle, and this would be the right ventricle.